Welcome to the nursing tricks. Basics are the basics and you can't skip the basics. Today we have to discuss about ABG interpretation. It's arterial blood gas. The normal value of pH is 7.35 to 7.45. 7.35 is acidity and 7.45 is alkalinity. Then PaCO2 level is 35 to 45. HCO3 it's bicarbonate, it's 22 to 26, and PaO2 oxygen level is 80 to 100. Then we move to three-step ABG interpretation. First is identify if it is acidosis or alkalosis. pH. Identify if it is respiratory or metabolic. It's CO2 या HCO3. Third is identify if it is compensated or uncompensated. So let's begin. First is identify if it is acidosis or alkalosis. The normal value of pH is 7.35 to 7.45. If the value is less than 7.35, it's acidosis. If the value is greater than 7.45, it's alkalosis. If pH 7.25, it's acidosis. If pH 7.55, it's alkalosis because it's more than 7.45. Second is identify if it is respiratory or metabolic. It's respiratory is CO2 level and HCO3 is metabolic level. First we move to concept method. Concept method having PaCO2 it's acid respiratory level and HCO3 is base, it's related to kidney metabolic. Then we move to question. The first query is the question is pH is 7.25, PaCO2 is 50, HCO3 is 24. Then pH is less than 7.35 is 7.25, it's acidosis. PaCO2 level is 50, it's more than 45, it's respiratory acidosis. And HCO3 is 24, it's normal. Then its solution is respiratory acidosis. Second query is pH is 7.56, it's more than 7.45, it's alkalosis. PaCO2 is 28, it's respiratory alkalosis. Then HCO3 is 22, it's normal. The solution is respiratory alkalosis. Third query is pH is 7.56, it's more than 7.45, it's alkalosis. PaCO2 is 40, it's between 35 to 45, it's normal. HCO3 is 35, it's metabolic because its normal value is 22 to 26. There is solution is metabolic alkalosis. So that is clear about metabolic or respiratory. Third is identify if it is compensated or uncompensated. Firstly, we have to check in case of respiratory acidosis, yeah, alkalosis. In case of we have to check base. If the level is in between 22 to 26, then normal value it's compensated. If it is acidosis and more than 26 level, it's partial uncompensated. In case of respiratory problem, the patient admitted, we have to check the acidosis and alkalosis problem in related to base. If patient is admitted to the metabolically problem, we have to check CO2 level in case of acidosis and alkalosis. Then query is pH is 7.30, CO2 is 50, HCO3 is 49. 7.30 pH is less than 7.35, it's acidosis. CO2 level is 50, more than 45, it's respiratory acidosis. And HCO3 is 49, it's compensation, but its value is base normal more than normal, it's partial compensation. In case of compensation and partial compensation, we like to check firstly diagnosis. If the patient admitted on respiratory conditions, we have to check CO2 level. If the patient admitted with metabolic problems, we have to check HCO3 level, its base. In this case, Patient admitted with metabolic problems and the pH is 7.50, it's more than 7.45. It's metabolic alkalosis. And the HCO3 is more than 22, it's partial compensation because CO2 level is more than 45 and the pH is more than normal. This is partial compensation. A question is a client who is found unresponsive has arterial lowing, pH is 7.12, PaCO2 is 90 and HCO3 is 22. The nurse interprets the result as indicated which condition. In this case, the patient is unresponsive. The pH is 7.12 is less than 7.35 is acidosis and PaCO2 is 90, it's more than normal limits, it's more than 45 and HCO3 within normal range. Then the solution is respiratory acidosis with compensation. Respiratory acidosis is clear, HCO3 is 22, that's why the respiratory acidosis with compensation. So it's all about ABG interpretation. Thanks for watching.